I am Dr. Sandeep Dhavan, Senior Consultant, Department of Gastroenterology at Evercare Hospital, Chattogram. Today we are here to commemorate the World Hepatitis Day, which happens to be on 28th of July. Hepatitis is swelling or inflammation of the liver. The main cause of hepatitis is viral hepatitis, and there are various hepatitis like hepatitis A, B, C and E. All of them lead on to jaundice. Now the hepatitis A and E is spread through contaminated food and water. That is, if we consume any contaminated food and water, then one is predisposed to get hepatitis A and E. Whereas hepatitis B and C is spread through contaminated blood and body fluids. That is, there are patients who are thalassemic who require repeated blood transfusions, patients who are kidney failure and are on hemodialysis require multiple transfusions, and one may go for surgery or any other procedures in the hospitals. They are also predisposed to get hepatitis B and C. So what are the symptoms of hepatitis? When one gets hepatitis, during the initial period there is loss of appetite. You don't feel like eating, you feel fatigued, malaise, and there could be fever, nausea, and after a few days the jaundice appears in the eyes, the body becomes yellow, the urine becomes yellow, the stool may be white, and there may be itching all over the body. So how to differentiate whether you are suffering from which virus? It's only through the blood test that one knows which virus is inflicted in your body. And it's very important because hepatitis A and E are usually self-limiting, whereas hepatitis B and C can become chronic in few of the patients, especially the younger ones. So one must always get investigated and go to the doctor and ask what type of hepatitis he or she is suffering from. The basic principle of the treatment is rest and take adequate diet and nutrition. There is no specific medicine to treat this hepatitis, and this hepatitis usually resolves in 4 to 6 weeks. Are there any ways to prevent? Yes. So if one takes simple precautions like washing the hands before taking food, avoid taking any street food, and taking boiled food always, don't take it from the fridge and right away eat it, just warm it. Then if one is going for the blood transfusion, make it doubly sure that it is hepatitis B and C negative. Do not share your razors with anybody, and these are the few precautions through which one can prevent hepatitis A to E. Another thing is, these days youngsters are in the habit of getting their bodies tattooed. They should make sure that the needles which are being used for tattooing are sterilized. So with these simple precautions one can prevent these viral hepatitis. In addition, hepatitis A and hepatitis B, we have vaccination. For hepatitis A only 2 doses are required, and for hepatitis B 3 doses are enough. So if you get yourself vaccinated for hepatitis A and B, then during your lifetime you won't get these infections. So I'll request all of you to propagate this information to your peers, to your neighbors, that hepatitis is preventable by following simple precautions and as well getting yourself vaccinated. Thank you very much.